Okay, so today it's a case study. We in LifeRx Wellness. We have athlete Roxy, and she just recently injured her knee. Is that the right one?
Yep.
And she experienced that pain on the side, right in here, right?
And ligament patch.
And a little bit down, so on the side. So tell us what's happened.
Well, outside of being an athlete,
Yeah, I know.
I was riding a scooter down a hill, and I used my foot to brake, and all of that kind of torque went into my knee and kind of dragged in an internal rotation. So I think, I don't know.
And plus, you have your
What?
nephew in front of you.
And I had my nephew in my lap. So
And your laps. Okay.
so extra weight, drag,
Exactly.
torque, speed, all the
So you
recipes
push
for
it, and do you feel like it's like a pop fast, or it's drag you right away and it's drag you down?
It was a drag, like
Uh-huh.
it dragged, and the speed and the like, you know, the car sound that just made like the
Yeah.
like that.
Okay. Wow. This is, you know what, this is what most injury coming. People tell me like crazy stuff. Like some guy went to the backyard and he don't know the dog is up there.
Yeah.
And you know the dog is
Yes.
try to bite him, and he's climbing on the tree and broke his ribs and all that stuff. And yeah, what's the call? The male die more than female because they're more crazy. Do
Yes.
Crazy stuff.
More risky.
Yeah, risky. What's that? You see that the reel on YouTube? It's a stupid way to die. Never see that
Yes,
one?
I've seen those.
Yeah, here we go.
Yeah.
And most it's a guy up there.
That's right.
So everyone who's injured do some crazy stuff. Jump from building to building, and that's what the most injury coming. Yeah, because you know we're young and crazy and do some crazy stuff. But it's good. This is what the life is. So what I'm see here, it's been impact. If he just comes up with a knee pain, we probably do some tests. But that was impact, so it was mechanical problem. Contact. So what we're doing right now, I just want to just observe what's happening, maybe touch the knee. Is that any pain here when I
No.
touch it?
Not to touch, no.
Not to touch. So tell me, where is exactly like when pain is happening? Like when you stand up, when you sit down?
If I'm in a kneeling position, kind of like you are, and I try to get up from here, that will give me sharp pain in these two spots right here,
Okay.
and it'll give out, so I'll kind of stumble. I won't be able to get up.
Okay. So in this case, what we see, what that move is, what kind of action in this leg? So we have extension of the hip, right, guys? So we have extension of the hip. What else we have? Hamstring effective, glutes, and basically all muscle, like in the leg. You feel that? You feel any pain?
No pain.
So what I'm doing, I'm going to palpate under the knee, just see if any swelling in any sensitive spot. Is any change, any color? Do you see any color changed?
No.
Okay. Do you do anything to help this, prevent this pain? Like, I don't know, put some ice or heat? What relieved that? Or just the drugs?
No, I haven't done any medication on it. I've just been avoiding the things that have been putting it in pain.
Try to go natural way all the time. If you can take the pain, and you can take the pain relief killers, but try to stay away from it because it's bad for your liver and other stuff. Okay, so I'm gonna palpate and do a couple tests with this ankle. And you stay on your leg before? I saw you stand on one leg just like that, right?
Yes, I can.
Is there no problem with this?
I can stand on one leg, no problem.
Yeah, you see balance, a little bit shaky out there. Okay, go ahead, sit down up here on the table and bring your leg up here.
This way?
Yeah, this way. So what I'm doing the crash test. I'm just kind of see if any wobbling happening here, and a little bit right here actually. Now I do kind of try to separate the knee, see if any pain. Is there any pain?
Nope.
I'm moving to the sides. I want to make sure it's nothing being like damaged. I don't see any swelling. I believe she's lucky. Nothing is serious stuff. So if, just give me an idea, it's turned this way or like this, right?
Exactly, yeah.
So you see, the most of the time it's coming to this lateral collateral ligament. So that could be the pain. I mean, that could be put too much pressure on it. You see, this is contract up here. When she she did that forward and it's drag her back here. So you just investigate and see what could be the problem up there, right? So she'll tell you the story, like in my mind, it's here and it's twist me here. So why she's experienced pain up here, right? I just ask these questions in my head, like, detective. Always want to be a detective. I'm just kidding. All right, so what I'm thinking, it's maybe that fibula, that joins between fibula and tibia problem, and also she may be like, sprain her femoris muscle, rectus femoris, the muscles at the leg, the biggest one, okay? So this is just idea what we can do here. And I can feel it's right in here, okay? So we're gonna start treatment. Usually start work a little bit with the quads, just make sure the customers feel like, how I'm gonna say that. The pain is there and I work directly on the pain area, but the idea is just relax my customer like here, okay? Because most people think if I'm start from somewhere else, let's say I'm gonna start working in the back of muscle, they're gonna think, oh, they're not doing what they're supposed to do. I tell them pain is here. So I will always directly start work with the pain area, okay? So she said pain, I'm like, okay, I'm just work a little bit around the knee, just get this idea for, okay, he's focusing, he listened to me, the pain in the knee, so he's working on my knee. But in general, you just try to relax your customer and you do completely different stuff. You work on that hamstring muscles and of course that tibialis. This is the idea. Anyone else want to add something? And very gently,
That's it.
That's it? You feel it? You feel the pain or you feel restriction?
Restriction, but this is the side that also has the labrum tear in my head.
Yep, so
You
here
have
we
a
go.
labrum tear?
This one is
So everything comes up. You see, she just tell us this new story. So something happened here a long time ago. And now, this is, can you think about this? This being injured, now this injured, and that's all the line. So
That's next.
it could be, you could be if you're not fixing the problem but that's okay. So what we're doing here, of course, we're gonna treat the knee, but in the future, we want that hip. So what I'm looking for ankle, remember? I wanna twist this 20 degrees and it's not twistable. You see that? So this is already telling me something like, up here, it could be. Because you see, if this is all connected. Now, external, it should be good. Is any pain?
No.
Don't experience any pain. You see, that's good. That's not good. It's just stuck right there. So this is suspect. The hip is suspect. But like I said, it's only if she's not telling me the story about like this. If she's come up with knee pain, that's going to be the first one to work on, and that the hip. But today, we'll just work around, give her a little bit correction training, and see how she's gonna do it. Okay. So, what my first thing, can we kind of pull this up, or I can bring another sheet for you. You okay like this?
This is okay?
Yeah, this is okay. Yeah, perfect. So whatever his camera is. So this is, I usually put on the side, but in this case I don't because damage. I always pay attention like what they said, and not to be too much. And this is how you guys the quads. You work like this with quads. Just bring on the side and watch. People you can do this way, or can ask clients to just bend. Or you can just resist like this and work with one arm. You see what I'm doing here? I just do that. But, like I said, being injured, so I grab that and just work around that patella. I just see if any ligaments, like the tendons is painful. Is any pain?
No.
Good. So now I do deep friction right above that knee. Okay, let me put the camera up here. I'm working around that tendons. Just feel it. Is that painful right there?
No, just tender.
Just tender. Okay. I don't want to loosen up. I'll be honest with you. We don't want to loosen up because knee, it's a stable joint. So it's a work of stability, not a mobility. I can feel under but we're gonna get there back. So what I'm doing, I'm gonna squeeze that and really laterally, not in the middle, not in the middle of the knee. I'm not going in the midline, it's all on the side, okay? So, but idea is, yes, as you can see, not a lot of oil. I just wanna go very slowly. I see you guys doing that. That's too much. So, and it's for you too much and for the customer. This muscle is really sensitive and we don't want to really stretch that. We just want to like just get her idea how's that feel, and she's gonna be oh, it's tight right there. Usually people, oh, it's tight, but it's usually it's a bone. You just put against that femoral bone, and this is my speed. That's it. See, if you're a big like a big guy up there and you tiny girl, you sit down on the side, you kind of a little bit turn, and you can use right here, and you just use your forearm. You see that speed? How's that feel for you?
Good.
And this is what I do. That's it. I'm leaning, and I can, I don't know, smoke cigarette here, or read the bag. Yeah, read the book, and just how's it feel?
Good.
Okay, good. You see, it's just perfect. No rush, and it's really work. People really like that. How's it feel?
Relaxing, actually.
It's relaxing. It's good for her. It's good for all of us, because with too much interrupt, too much chaos, too much show up there, right? Show everywhere. Okay, how's it feel?
Good.
Like I said, this movement, it's only for a customer like, hey, I'm doing what you want me to do, because you know sometimes people come in and they want exactly that painful spot. Just get my pain away. And okay, how's it feel?
Good.
All right. Does anyone want to try to do that? More work?
Yes.
Okay, here we go. This is really good. So slow. You got massaged to death today, Roxy.
I'm not complaining.
Yeah. At the massage school, I'm always like, please, pick me. And there was most girls, and a big guy, they say, no, I don't want that. And I'm like, where are gonna massage me?
That's funny.
Yeah, they don't ever massage me.
I love it.
Yeah. Long stories, funny stories. Good. You want to use your thumbs? Yeah. You see, the thumbs. I used to use my thumbs, but when I get arthritis, that was no fun at all. Trust me. That's so. Try to use this part. Hold on. There we go. A little bit turn. Is that soft tissue or you feel bone? Tell what do you feel?
Soft right onto the bone.
You feel good? Is
Yeah.
it? Yeah. Perfect.
Feels
Yes.
nice.
Yeah. Always ask your clients how's the pressure, how you feel the pressure, and if this is too much, you let me know. Always communication. That's what the communication is. A perfect treatment. If we're just doing silently, I know some. I mean, if person say relaxation, and if you do silent, it's perfect. But if person come with the pain, we always have to communicate with him, because yeah, you need to know what's going on up there, and that's the main idea. Okay.
Okay.
Yeah, people ask if I work on the IT band. I usually don't work on IT band, but just like I said, for people feel good because they know IT band, it's tight. Someone tell them it's tight, and that's you have to work on that. IT band is a tendon, and it's not even stretchable. If you try to stretch this, roll it, it's not doing anything. So you see a lot of people try to roll it or stretch the IT band, they just wasting time. It's not stretchable, the IT band. And to work, yeah, just feel good. What I'm gonna do for sure, I want to do cupping on her, and that's what's really gonna help me to work on that rectors femoris. I will take a couple cups. Are you okay to be cupped?
Mm-hmm.
You know, you okay?
Yeah.
Because sometimes people are like, oh, I remember a 15 years ago when I start my career, like massage career. I know about cupping like since I was 5. But anyway, I put too much cups on my back. I try to go to the pool, the local pool. So they not allow me to go inside because they thought I've got skin disease. That's because people don't know. And after the Phillips, the swimmer guy shows everyone what the cupping is, everyone was so excited about the cupping. But I believe cupping you have to do with the movements. It's not just hang up the cups up there. People do all kind of weird cupping, like bloody ones or fire one. I mean, I do fire. In this case, does that feel okay?
Mm-hmm.
And I want to put another one right here on the side. So what I'm doing here, I am bring the blood. And people like say, oh, you lose like the ligaments. No, I bring the blood to this area, and as you know, the natural healer of your body, it's a blood. You broke your bone, the blood is going there. How's it feel?
Good.
You okay?
Mm-hmm.
All the time communicate it. Now I just want to do movements. And I try to bend this knee. How's it feel?
Good.
So you see what I'm doing here? This is what the sport massage is. This is what sport, medical. You try to restore the movements. Very slowly. Now ask her to push this foot up. I'm holding, push this foot up. Is any pain? Let it go. So what she's doing here, she push up the foot. I'm holding it. If you want more, because the camera, I just put my knee and she push up. Or I can go lower if I want, whatever I want. Right here, you see, support it. It's just because the camera. Okay, how's it feel?
Good.
Push up. Let it go. Release this cups. And I will probably put a couple more up here and up here. Just work around. Like I said, bring the blood. Doing okay?
Yep.
I'm not trying to loosen the ligaments. Okay. Is the skin, you feel that skin friction?
Mm-hmm.
Yeah, it's like kind of pinching you. I mean, we're all different, but some clients come in and they do specifically like super painful massage. When you experience pain, your body kind of lock everything and can't relax. So painful massage, it's maybe good for, I don't know, your mental release, but for body, it's not a good idea. So, okay. How does it feel?
It's feeling really good, actually.
Very good. It's feeling really good. And you see, we just do a minute because, yeah, and the video purposing. But I'll go doing up to 8 minutes, 10 minutes. You guys, any questions on this part? Okay, so what we're doing right now, we're just gonna go back to the tibialis muscle. I want to make sure everything is worked up there. Okay. Knee pain, the lateral knee pain. I want to work on the tibialis muscle. What I'm doing here, so I ask my client all the time, so I hold in this tibia muscle and ask my client to move that ankle up and down. Up and down really slowly. And what I'm trying to do, how's it feel right there?
It's good.
So I feel, you see, this is the tibial bone and the tibialis muscle. What I'm feeling, it's
tender right there.
really tender. Yeah, it's really, it's kind of maybe how explain that? It's, you feel like smooshy stuff in there. For me, that's what I feel. That's what maybe the injury is here. The soft tissue try to recover now, and you can feel it. And around is like a little bit tenderness around. This is how I usually palpate. Here we go. How's it feel right there?
It feels like you're pressing on a bruise.
On the bruise, you see, that's what she feels exactly. So the tissue been bruised. What are we doing here? We try to bring the blood and make this muscle work again, because they try to protect it now. They might be not moving much. Here we go. Try to relax now. Don't do anything, and I'm just work on the tibialis muscle. You can do one hand. You can do both hands. Make sure you don't push on that tibia bone. So between the fibula That's feel really good. See what I'm doing? So 2 hands, and you can just glide up. And here you glide down. You can use your fingers, you can use your palm, you can use your thumb. Like for her, I will use the thumb. For the bigger guy, I will use the whole thing. Now I grab my palm right in here. I find that fibula bone, and what I'm doing, I'm a little bit separating. You see what I'm doing here? I'm separated fibula and tibia. I'm pushing this way. Okay? How's it feel?
Good.
Really good.
I like those ones. Those ones are good.
So you see, look, springing, go back to this tibia, and go all the way down. Okay, now I ask her again to move the ankle. Why I'm doing that to her? Because remember, she's kind of, when she's trying to stop, it's being impact on her ankle. So I want that ankle, make sure he's working. So it's nice and smoothly dorsiflex. And you can see she's struggling. There we go. I'm gonna help her out now. Maybe something is not working. Do you feel in your knee something?
No.
Okay, so this is the idea. Really good. Come back to this tibia bone and ask her to do again. Yes. There you go. Right there. You feel that bruise still there? So what she's doing, she just work out, and I feel that it's popping right under my fingers. There we go. And get a little bit of rotation, left and right. Nothing painful.
No.
Okay.
Oh, that's tight.
Okay, she said tight, I'm laid up. I don't do crazy stuff. And here we go. All right, so you guys come up and try this work. No, hold on. Back straight, more straight. Here we go. Lean. Now, arms straight. Arm straight. Here we go. Use your weight, and you just slowly move. When you bend your arms, you put everything from your shoulders. While when you straight, you use your body weight. Try the one arm and see how you like this one. So come up, straight arm, and you just push from your body. How does it feel? Which one is better?
They're all great.
Okay, you see, you're good. So. And this one, so let me show you again. You just pick one, yeah, or this one on the top. You see one finger? My hand is straight, and what I'm doing, I'm just lean. See my other one, I'm support, and I can be here, I don't know, 20 minutes. I can just stay here. She can breathe, she can start move her foot, and that's what, helped me. And you feel it. Ooh, right there. Try it. 2, 1, whatever you feel. Make sure you just use your straight back. That's why we do class, and we teach those bands to shift your weights. Yeah, deadlifts. Ask her to move. How's it feel? And this one is gonna turn more inside. You're doing good, So yeah. Bring more injured people, so with all type of injuries. Yeah, you can pull this down. We don't want that compression.
So we have to choose one of those moves, or
You can do all of them if you want, if you have time. Like Marina, she did 2 hours massage just legs. It's crazy. 2 hours legs. I don't know. I'm probably gonna shoot myself. Do 2 hours leg? Oh my God, it's just crazy. Yeah, this is the good topic. If you're seriously injured and you think the many hours massages is gonna help you right away, you're wrong. So you have to start slowly. You have to start like a 45-minute session. You want to just recover really slow because you're in pain. You don't want to put too much that pressure on your body, like massage. And plus you're gonna be sore because maybe you release too much lactic acids too at the same time. All right, so here, like I said, we can put some cups up here too. You got that one, Miranda? You
Yeah, I
good?
understand that.
You're good with that? All right. That lateral gastrix is a little bit kind of bumpy up here. Okay, it just give me an idea. Maybe that's something out up there. So what I'm doing, I'll come right under that knee, and people say, yeah, what about the arteries up there and everything, and nerve? I'm like, yeah, but I'm really gently. I'm kind of pull to this to the side laterally. So I grab that tendon and I kind of try to separate. Is that okay? Does that feel good? Whatever is, like, just communicate with your customer when you do stuff like that. So what I'm doing here, I push and separate it. Okay. Try it. Doing okay? There we go. Yeah, and go a little bit down, and what I feel that hamstring is, wow, do you feel that? That hamstring is just, if you just gotta touch it, you feel that hamstring. So now I come to the medial side and do the same thing on the medial side. Pain up there? Okay, she's good. I'm always look at the people's eyes. If they just doing this to you, that's mean you're good, you hit it. And you can tell them, hey, I charge you extra if I can do this for 1 hour to you. Yeah. No one get the joke, but that's okay.
I didn't hear what you
No, people they like pain, and sometimes they're like, hey, I'll pay you extra if you just keep hitting that spot. And you're like, okay. No, just a joke. So, feel it right there?
That feels like a bruise.
Yeah, I feel another bruise up there, so. What I'm doing, I'm just like a deep friction, okay?
Creating space.
And now here, I grab that fibula. You see with my thumb, I place the thumb up here. I place the thumb like this, and what I'm doing, I'm pushing forward and backward. I create that movements in that joint, tibio-fibula joints. Tibular joints, and moving right side. Okay, really good. How's it feel?
Okay.
I feel that good movements now up there. I wasn't before. Okay. And now I'm gonna mobilize that hip, mobilize that ankle, and we going to do exercise. Okay. Any questions here? You guys want to try it? So what I'm doing here, I lock this knee. I'm not make sure the knee is not gonna moving. I push this down with my both arms, and I push it down. See what I'm doing here? If you are tiny girls, a big hand, you can even lay down on it, but I don't need it because I put 15 pounds, 20 pounds pressure. So I push directly in that socket, and what I'm doing here, I'm start slowly rotate, make sure it's no pain in the knee. How's it feel?
Good.
I really kind of rush myself to do that today. I'm probably supposed to do this in like session number 4 or 5 because we still have an injury. There's still a pain. But what I'm doing at the same time, when I'm rotate, I touch that, massage that hamstring so I feel that. How's it feel?
Good.
I'm right in there. And when I'm rotate, I want to feel that. How's it feel? Right under my big thumb right there, and I feel this one. Doing okay? We don't know. He's just been injured before. Before that, it's maybe that heat or the scooter ride. That was just the boiling point. Maybe the trauma injury was already there, but that impact is just activated. That was the final push. How does it feel?
Good.
Yeah, definitely up there.
That spot is tender.
That spot is tender, so I'm just gonna hold it and keep moving. Okay. Okay, and I'm release that. Okay, and now we ask her, you guys any questions? When I'm done, what like, you wanna try something on that leg? You wanna try this leg? Come up here, let's do mobilize her right, left knee now. So it's body mechanic, shift it, shift your body, look, lean, you see? I'm here leaning and back, like back, here we go, perfect. Sound like that. If your back is, yeah, you see you put too much on your back. If your back is hurt, that's mean you're doing wrong. Because you're gonna get tired. To do 20 minutes like this, you're gonna get tired. So yeah, I'm holding it.
I was holding my.
Yeah, watch. You see, I'm pulling, and the idea is I just want to see, like imagine she's walking, and right there, wow, that just pops. That's serious, like pop right under my finger. So what I'm doing here, I'm gonna gently work on that spot. I'm not even move my finger. You feel that?
Yeah, that is a little painful.
So I'm back up because I feel it. So I know it's going to be always think it's like something tender, super tender under. Just and go work around. You don't work directly on that spot. Okay, just add some movements. I want to add a little bit of movements up here. You know, remember this, she got a lateral pain of the knee, so I'm not going to add some lateral pain, just a flexion and extension right now. I just want her to make like, you know, she's safe, she feel okay, the movements is fine. And I'm kind of work on that hamstring muscle because that's what my suspect too, because when she push, everything is just kind of like, you know, put it all together. It's like a car accident, you smash everything. The bone is shifted forward, everything. It's not just like I know it sounds like a game, you have fun, but that's what the most injuries come in. And we don't pay attention to that. And it's create more trouble in the future. So this is what I'm doing. Here we go. And you guys really gonna feel that kind of stuff up there. Yep, right there. Come up, very gently move that knee up and down and you will find that spot right there. Come up here. So touch that right in here and just move and you feel it. Just play around, see how's everything around. Is that the spot like last? There we go. Don't go that much.
Not too much.
Yeah, because we don't want to stretch that the tendons. That patella tendon, yeah, we don't want to mess with that. Just make sure. Yeah, and just work. Good. Okay, does that go away? Is that less tension tender right now? That spot? Or you still feel
It's still
it?
tender.
Still there? Okay.
Yeah, a little bit.
Is Yana gonna come up here and do the same? Let's just. Okay, yes. Okay, right there. Just work around very gently, up and down, and see how's the pressure. And if, okay, whatever you want to use. Don't bend so bad. Like don't bend far. Yeah, just light motion. Yeah, there we go. That's it. Perfect. Yeah. Perfect. Yeah, if you guys want to learn massage, we're here in Glendale, 1616 South Victory. If you want to really know something about professional medical massage, just give us a call, text us, and we'd be glad to see you in our clinic and teach you some good technique. Most important, helpful technique with big benefits for the clients to make them improve their health. And that's what we do. Really good. You see, she's really like straight. She used her body back. She's not bending forward too much. It's great. And how's it feel for you, for the customer? Good. Customer happy, everyone happy. Book us today. Yeah. All right, perfect. So now I'm gonna add a little bit lateral and really good. So now I'm gonna add a little bit lateral and medial movement. So I'm just gently start moving around. Is that any pain?
No.
No, she don't experience any pain. Whatever is, I just want to feel it and make her feel safe too. If client's not safe, they're afraid, she's completely relaxed. So sometimes you grab this leg and you try to pull and people not let you allowed to do that. That's mean he's He's guarding this pain. He's in pain, and we need to reset that. So because it's in the head, it's a nerve system. Okay, you try to crank it, you try to break it, and next day person gonna call you and say, I feel worse, because you try to like fight with him. Don't let the people fight with you. If you see if he fighting you, okay, just push it and hold it. He's gonna give up sooner or later. So okay, sometimes people you massaging head, you hold the head, you let it go, and the head's still in the air, and you're just like, holy smoly. That's how people so tense up, they can't relax. This is first signal. You have to talk to this customer. Hey, you want to see me a lot right now because I want you completely be relaxed. Just think about it. This is soul body in stress. He's not gonna stay longer like that.
Sometimes,
Yeah.
sometimes people don't feel any pain, but they cannot relax, and whatever you keep saying, they still cannot.
You can, yeah, you can tell
But
them.
it's not painful. I mean, they don't feel any pain. They just like make this muscle.
Yeah, contract because they stress. Like I said, they don't know about this. People don't know. Trust me, I just know because they call me Yuri. I'm 1978, February. I'm a male, and that's it. That's all I remember myself. And that's what the most people remember. But you don't know how walk, what's going on with you. Yeah, that's because that's what we're doing here. We check the motion. We see how people moving. And that's what we have to let them know. Hey, it's something not working. This is not working, or you too much stress. You need to see me. Yeah. So this tender, I just want to really work on that with the motion. And you see, I can move around that knee. That's really good. Now what I'm doing here, I do this tuning fork. I push this knee. I grab this ankle and push this knee a little bit down, like a bouncing back and forth. And now I turn. Left and right, left and right. Is that penny pain? You see what I'm doing? I'm doing this. So I push 5 pounds and I rotate it around. I just want to lubricate that fibula, tibial bone, that ankle too. Okay. So that kind of stuff. And of course, like I said, we have to look at the lower back. We have to look at the thoracic area, ankle, all that stuff. We just one piece. We don't treat the specific area. Like, okay, my hip is in pain. Why is it in pain? We have to find out what's going on with this person, because most of the time we're chasing pain, but the problem is not there. It's something else. That's why that kind of treatment and assessment are very important. All right? Any questions? No? All right. Just like I said, remember one part, practice, understand, yeah, and practice again, and you're gonna practice, keep practicing, feel it, palpate it. You might be not feeling in the beginning, but more practicing, you're gonna be more accurate, you're more sensitive, you're gonna feel all that tender spots and tonicity. You will feel it. You will feel something wrong. It's not like a normal soft tissue or